Okay, go ahead, Joe.
Okay, good afternoon. It's Joe Nicholson, the City Manager. I'm going to be somewhat brief today. I'm scheduled, along with other employees of the city, to take a MedPod vaccine distribution training today at 5 o'clock, so I'll need to get on that Zoom webinar shortly. I want to note just at the outset here, the city's lost today of a giant of an employee, Tim Mills. Our thoughts and prayers go out to Tim's family, and as you all know, Tim will be sorely missed. Our numbers, getting right into the numbers, as you all are aware, are increasing. We have 74 new cases that have been presented to us. Both Middletown and Portsmouth have also experienced significant increases. With that said, our positivity rate remains at 4%, as does Middletown's. Portsmouth's positivity rate has increased to 5%. I compare it to Central Falls, for example, which has a dramatic positivity rate of 27%. I would also note for you that there were only 2 other communities in Rhode Island with lower positivity rates than the city of Newport. New cases statewide continue to climb. It was reported on the RIDA website that the state recorded 948 new cases of COVID today, with an overall positivity rate as reported on the Rhode Island Department of Health website as percent positive prior day at 7%. Of note is that the Center for Disease Control indicates that the average daily cases per 100,000 in the last 7 days for Rhode Island is 123.8, which, by the way, is the highest in the nation. You may have viewed some commentaries and listened to the governor's press conference today as to the cause of this dramatic surge. I'm going to leave the council and others to those commentaries, but the governor discussed mobility as being a driving factor. Dr. Bricks and Dr. Megan Rainey, a Brown University emergency room physician, referenced indoor environments, a densely populated state, multi-family and multi-generation homes, and a high nursing home population in the state of Rhode Island. I actually read one article yesterday about the mobility of college students and a reference to the Rhode Island's high collegiate population. The issue came up at the governor's press conference, and I would describe it as the mystery of the surge. I think one reporter used the word mystery. The governor noted that the test positivity for Rhode Island is in the middle of the pack compared to other states. Early data that the governor presented at the press conference and discussed suggests the pause is working, along with pinpoint testing and attention to high-density communities such as Central Falls, parts of Providence, and Pawtucket, I believe she mentioned. On the local front, there's little within our control. However, in discussing matters with Colleen Germain in the school department and Tom Shevlin, our communications officer, we've decided to get back to a very simple messaging. We'll get back to the basics, and that's gonna be the title of our new plan, Back to Basics. And it's simple: wear your mask, wash your hands, stay at home if you're sick, and sign up for our alerts. We're going to push out that information very aggressively through local media sources, as well as use our rave alert system. On the vaccine front, the anticipation is at least frontline workers will start to receive vaccinations next week. There's a whole vaccine plan. If you paid attention to the governor's press conference, those are considered the 1A group, which consists of the highest priority groups: health risk healthcare workers, EMS workers, long-term care facility staff and residents, and other first responders. And then there's other subgroups that follows depending upon the supply of vaccines and the successful rollout. We've been advised by the Rhode Island Department of Health to activate our MedPod plan. And what that means is, as a local community, we start to mobilize and get our act in order so that we may be a distribution site for vaccines in the near future. We're not there yet, but we're going to mobilize and get organized to have some and pinpoint some places that we may be providing as a vaccine site, or sites, I should say, and that's in the works. We have a full manual that discusses how to organize these med pods, and that's one of the training issues that I'm going to view today at 5. Any questions, please?
Joe, one thing I wanted to make sure you mentioned, just in case folks didn't watch the press briefing or it hadn't reached them, is an important thing, the pause being extended to the 20th.
Oh, yes, the pause is going to be extended 1 week, I think, to the 20th, and then on the 21st, at least the plan now is they're going to massage some of those categories of note. I believe that restaurants indoors can go to 50%. It's still limited to the idea of household tables. That's pretty much it. Venues of assembly slightly increased. Those are the two major differences. Everything else really stays in place.
And then I can't remember it off the top of my head. Do we have? Can you share the dates that all of the schools are going to full virtual learning until? I thought that they were.
No, I don't have that information. I didn't get that information.
Thank you.
I'll roll that out. I'm sure it's, there was a lot of information today, and as quick as they, I'm sure it's on some media source. This could be a world's record for this.
Does anyone from the public?
Well, we usually don't entertain that. This is a briefing to the council.
Well, I think if folks have questions, it's good for us to answer them, but it doesn't seem.
Well, again, I'm gonna suggest to the public that the Rhode Island Department of Health website is the most accurate information, and what I've just iterated to you is well across all the media venues today. The only distinction that I'm making today is our own decision as a staff to get back to the basics, which I think that's we need to hit on that. We've considered that quite a bit. There's so much information out there, it doesn't hurt, and I think Angela continues to say we need to keep repeating a lot of the issues, and if we just get back to the basics and keep hammering those, I think maybe it'll be effective. Seemed to be effective during the summer, maybe they'll be effective now. I do want to stress we're doing pretty well comparatively, but 74 cases is not good. The other issue is this MedPod rollout. It's an organized process of site selection. In the event we're able to be a distribution center for vaccines. It hasn't been decided yet whether we are or whether any site in Newport is. We still have to figure out which sites they are. Right now, the first, the 1A group, if you will, is going to be vaccinated. You have to go to 5 regional centers, and the closest one that we will be staffing in part is Bristol.
Joe, if people want to try to understand which group they're in, I know that the info is on Rido, but it's as far as, where it says moderate or significant comorbid, just if people have questions about that, in general, I guess, is the best way for them to get more info just to reach out to Rido, excuse me.
Rido, and they're going to refine those. If Dr. Chan said those are going to be refined as well. And actually, someone asked a question, I think on our after call at 2:30 with the governor's office. I think one of the categories is older individuals, and someone asked, well, what does that mean?
Yeah.
And the answer was it's going to be further refined and further advisories from the CDC. It's a top-down approach, in terms of the categories. All of this comes out of the CDC, and the CDC will issue the recommendations. Right now, they believe that the recommendations will follow the categories that the governor exhibited today at her press conference. I got to believe that they will anyways, because they certainly make a lot of sense. But there's a potential of some change there. So, but right now, and actually, I took a. Let me just see if I can pull this up on my phone, because I can iterate some of it to you. The phase one are as I said, the high risk healthcare workers, hospital staff, long-term care facility staff, first responders, long-term care facility residents. And then there's a 1B group, which is people with significant comorbid conditions, 2 or more, older adults in congregate care settings or overcrowded settings. And then phase 2, for example, the K through 12 teachers, school staff, child care workers, critical care workers in high-risk settings, people with moderate condition, comorbid conditions, people in homeless shelters and group homes and staff, incarcerated or detained people and staff, all older adults. And that's where someone, as I said, someone asked the question about older adults, and no one could really, that is apparently a category in and of itself. Phase 3, young adults, children, workers in critical industries. And phase 4, everyone who did not have access to vaccine in previous phase. And all of this, the way they described it, and it's all fungible, is the time period is from December basically to the rollout, the final rollout in June. So there's, this is not happening overnight. Phase one was December to February. They would anticipate. Phase 2, February to April. Phase 3, April to June, and then that there's 3 phases, and hopefully by that time we'll be in good shape. But as I said, it's all elastic. It's changing. When Brian Dugan told me about the MedPod, the activation of our MedPod system, we're still unsure, as I said, even though they told us to activate it and start to get organized, we still may not be at least the city may not be a central point under our MedPod plan of administering the vaccine. It may be through the hospital, it may be through CVS, it may be through other outlets. But the point is, we're getting organized.
Is there anything else from anyone? I think we're done. But thank you,
Sure.
Joe. Thank you,
Great.
everyone.
Okay.
Thanks, Joe.
Thanks much.
Thank you,
All right.
Joe.
Thanks.